What is substance abuse? Substance abuse is a voluntary use of a substance to obtain a state of euphoria or a state of calmness, which can be through sniffing, drinking, smoking or inhaling the substance. There are different methods which can be used to consume the substance. These methods can be harmful to the individual and others around the person consuming the substance. Substance abuse can lead to serious problems such as poor schoolwork, loss of friends, problems at home, and lasting legal friends. Alcohol and drug abuse is a leading cause of teen death or injury related to car accidents, suicides, violence, and drowning. Substance abuse can increase risk of pregnancy and sexually transmitted disease, STDs, including HIV, because of unprotected sex. Substances most often exploited: tobacco, cigarettes, chewing tobacco. Long-term consequences of youth smoking are reinforced by the fact that most young people who smoke regularly continue to smoke throughout adulthood. Teens who smoke are 3 times more likely than non-smokers to use alcohol, 8 times more likely to use marijuana, and 22 times more likely to use cocaine. Smoking is associated with a host of other risky behaviors, including fighting and engaging in unprotected sex. The short-term health effects of smoking include damage to the respiratory system, addiction to nicotine, and the associated risk of other drug use. Smoking negatively impacts physical fitness and lung growth and increases the potential for addiction in adolescence. Smokeless tobacco may also cause many problems. It can lead to bleeding gums and sores in the mouth that never heal. Smokeless tobacco use leads to discoloration of the teeth and eventually may lead to cancer. Alcohol. The incidence of alcohol use increases throughout adolescence. Some out of the problems include impaired school or work performance, interpersonal problems with friends, family, teachers, and supervisors, physical and psychological impairments, and drunk driving. Alcohol use as an adolescent can lead to prevailing alcohol use as an adult and contribute to physical health problems. Many times alcohol use may precede with other drug use. Marijuana. Volatile substances, inhaled, such as spray paint and plastic cement. Cocaine, narcotics, heroin, ecstasy, central nervous system depressants, central nervous system stimulants. Risk factors. Parent who engages in substance abuse. Peer association, wants to fit in. School dropout. Problems with conduct. Biologic factors. Depression, about 50% of drug abusers are depressed. Assessments. Physical, social, and psychological symptoms vary according to substance. 1. Cocaine produces euphoria, cardiovascular manifestations, and seizures. 2. CNS depressants have sedative effects such as drowsiness. 3. CNS stimulants can lead to aggressive behavior, agitation, restlessness, paranoia, and boldness. 4. Narcotics use produces constricted pupils and respiratory depression. 5. Inhalants cause a feeling of euphoria or high, loss of consciousness, respiratory arrest. Assess for needle marks, tracks on arms and legs. Assess for behavioral changes. Drop in the school performance, grades, participation. Skipping school. Socializing with a new group of friends. No longer interested in activities previously enjoyed, sport activities, after-school functions. Engaging in risk-taking behavior. Trouble resulting in intervention from law enforcement. Planning and implementation. Encourage participation in educational programs that increase substance abuse awareness. Treatment for acute drug toxicity or withdrawal is specific to substance. Gastric lavage or narcotic antagonist are more often utilized depending on route of substance involved. Acute management includes maintaining patent airway, adequate tissue perfusion, and fluid volume status. Treatment for chemical dependency or substance abuse often requires rehabilitation measures and involves a multidisciplinary approach. Encourage youth participation in prevention groups. Refer chemically dependent child to Alcoholics Anonymous or Narcotic Anonymous. Child and family education. Educate parents and teachers about signs and symptoms of substance abuse. Educate teens on the following: short and long-term effects of alcohol, tobacco, and drugs on health. Risk factors and implications for unintentional injuries and sexual activity. Short and long-term effects of alcohol, tobacco, and drugs on relationships and school performance and progression. The hows and whys of chemical dependency.